And there we go. So welcome all to our General Assembly. This is the last one for our Certificate Peer Learning Program for Equity in Research and Practice. This is Maria Monson. I'm very happy to be your host today for this last assembly. I'm here with Charlotte. How are you doing, Charlotte?
Hi, Maria. Hi, everyone. I'm doing fine. Thank you. And I'm really looking forward to hear colleagues share their revised course projects and what they have learned throughout this process. Thanks, Maria. Over.
Thank you, Charlotte. I'm very excited as well. So let's get started because I know that a lot of you are eager to share with us. So in case you cannot hear me, just look where it says join audio in the bottom of your Zoom account and then join with computer audio to make sure that you are not missing on anything that we are saying today. Stop incoming videos in case that you have connectivity issues so you do not get you do not miss on anything and you do not get kicked out of Zoom. So this is the best way to do that. Just want to take 1 second to remind you that we have this new course on gender and emergencies that we would love all of you to participate in. I'm just sharing the link in the chat as well as the LinkedIn posting. So you can comment, like, and share with your colleagues so we can spread the word about this and we can have a lot of participants there as well. Okay, we were just saying about this, avoid interruptions. And the best part of today is the active participation, which is we want to hear from you, from all of you if possible, but at least from most. So just make sure that your microphone setting, audio settings, everything is working. And we're going to be asking for raised hands to see who wants to share. So this is our final presentation. This is day 16 in our course. And just as a reminder on how far we've moved, for those of you, and I have my big star here, we know that we have already asked you to present your revised project, and we have our list here of our honor roll on, and we want to do a big round of congratulations for those of you who have submitted your project on time. So if you have done so, your name is here in this list, and I'm very happy to see it here and to see all these participants that have been able to do so. In case your name is not on this list, we have a last opportunity for you, and we have moved a couple of days the submission of your revised project because we really want all of you to get your certification and to finish with the course. So September 26th, this is our last and final deadline for you to submit your revised project. Okay, we're going to look into the requirements for certification. And just remember that we are on September 23, so we are standing here in our General Assembly. And the other requirement is the feedback questionnaire that you have to complete to get to have everything for certification. So again, a short view of this honor roll that I'm very happy for all of you. Ariani, if you haven't submitted, we're gonna look into it. Sorry about that. Ariani is telling us in the chat that she has submitted, but the name is not there. Maybe it was after the deadline, but no worries because we have moved that a bit, so you are still good with the course. Let's go to the activities that are required for certification. And I really want to stay here for 1 second. Remember that when we spoke in our peer support sessions and in our other assemblies, that you have to see all of the activities marked as complete for the website, for the platform, to let us know that you have finished that. So I'm going to ask you to go and check in your dashboards, in your platforms, that you have everything marked with a green circle and a tick inside, a check mark inside that says that you have finished day 1, day 2, day 3, all the day's activities, especially the attendance, that it could have been that you actually participated or that you watched the video. the feedback for all of those days. Okay, the submission of your draft on time, and this was mandatory for you to get peer reviews from your colleagues, that you had finished those reviews, that you participated in the day 9 General Assembly, and that if you didn't participate, you watched the video and marked it as complete, that you submitted your revised course project. And this is something that we are going to be checking, that the project that you submitted has meaningful improvements, not just that you change a sentence or two, that we actually can see how your work has changed here. So that is why we are calling it a revised course project, and not the same one that you had presented as a draft at the beginning. So we will, the General Assembly, day 16, that is what we're doing today. And so this is also mandatory attendance. And then the post-exercise evaluation is what I was just telling you about, the feedback that is mandatory and required for you to continue in the path for certification. You can use, okay, Doctors Hati wants to see the names again. Sure, we're going to go here for your names. You can check them out here. And all of you who have submitted on time, I'm sure that you can find them there in alphabetical order. And if not, we can check again to see if anybody is missing. Yes, go ahead.
There's no need to worry about that. If you are confident, I think I even put the time. The time was actually 11:45 this morning. So you might have submitted afterwards. I don't know. So don't pay attention to this. If you're confident that it's on the platform, then fine and good. We can move forward.
Thank you so much, Charlotte. Yes, indeed, we can move forward. And like I was saying, you still have a chance to submit if you haven't, for that exceptional extension that we have granted, because we really want to see all of you finishing the course. Okay, so for the post-exercise evaluation, and this is the last feedback that we are asking for you. Okay, it's mandatory. It's a post-training evaluation. We want to know how your experience was. We want to hear from you. Okay, feedback is very important to us, and this is mandatory and required for you to continue for certification. We were talking just a few minutes before the General Assembly started, for those of you who had joined first. And here are the optional activities, okay? Peer support sessions, they were not mandatory. We had actually invited you and insisted on you joining to help your peers if you were doing fine, but they were optional activities. The remote coffee was also an optional activity. So if you did connect with somebody, or they didn't answer back to you, or if you didn't sign up for remote coffee, that is still okay. That is not going to influence your final completion. The self-care session was also optional as the self-review of your course project, okay? These were optional activities that you, if you haven't done it, you are still okay. But now it's the best part of today. Now we're going to be hearing from you. Manur, we can look at your case. I'm seeing your comment in the chat. We can look at your case later, but you have to mark them if you have watched them. If you were not present in the sessions and you have watched them, you have to mark them as complete for the system to have them with a green circle. Okay, so for the final presentations, these are the questions that we want to hear from you. Okay, remember, you will have between 4 to 5 minutes, and we want to hear about your course project. Okay, remember that these were the sections from the rubric. So let us know, very short, high level, what happened, what was the root cause, what was your role, what was your action plan, and at the end, how are you looking at it with the health equity principles? Okay, so this is the part where I would ask those of you who want to share with you. You know that we had a couple of hands raised before, and Bia, you were talking, I had to cut you off because we were starting. Are you able to share with us now? Have you been able to solve your problems with your microphone? But if you are, I was just asking you to unmute so we can all hear from you. Tamrat was also one of the ones that had joined early. And okay, Dr. Sambo as well. Okay, we're gonna go in order how you're raising your hand. So first we have Full Marine. Go ahead, Full Marine.
Hello, everyone. Good afternoon, good evening, good morning, wherever you're joining me from. Thank you so very much, Maria. I think it has been a very great journey. What happened in my project that I was looking at a case of inequality where vulnerable IDPs are refused free medical care provided to state-owned facilities because they feel that they need paid services rather than support to provide these free services. That was actually what happened. And in the course of analyzing the root cause, I realized that I had a kind of a two-stream root cause. One, there was really no community ownership of the primary health care. So uh, the state first or the staffs could decide whatever happens. And on my part as a project coordinator, one of the root causes was there was poor community engagement in my design of response. So, looking at what role did I actually play in the whole scenario, I think I did the design for the people, not working with the people, because if I had gotten down to the people, I would have already identified the problem and would have sought for a common ground and would have proposed a working solution rather than think, oh, yes, facilities are not running well, following the MSNS and everything. There are roadblocks to move supplies. So if we just provide the supplies to these facilities, tell them, okay, this is the support we bring. Please, when these people come, give them healthcare, it will go. So there was limited community engagement on our part. That's the role I played so much in it. And in my action plan, what I actually looked at was how do we engage the communities. I had some practical ways I could measure. That's my indicators that I could measure my actions after now. I have action points that I have to look at the role that the community will play, myself. So the first one, I was like, okay, how do I build trust and structure community dialogue in a way that we can decide what are the needs, how do we meet the needs. I also looked at how to strengthen accountability so that when things like that happen, the community can give feedback and then we work on the feedback. I can get the community's voices. Was equally looking at how to increase communities' participation in the planning, the implementation, and the monitoring through participatory actions, and how to enhance humanitarian coordination. And the last part I was looking at was advocacy, and advocacy to who? Advocacy to the community, advocacy to the humanitarian actors so that we don't come and impose whatever we have, because oftentimes we come with a pressure from the donor. You want to rush, you want to design, and then you go impose. And when you face challenges like the one I actually faced, some facilities refused completely, but then I was already in the middle, the supplies were there and all of that. So if I came in at that point, it would go. And one learning I learned initially when I submitted my project, I really didn't feed it into the equity principle. So when I now was doing the review, even following comments from other course mates and all of that, I took time to review this section. And one thing I really saw was that refusing care or limiting access to care to people because they cannot pay or whatever is a height of human rights abuse. Because according to the World Health Organization, health is a universal human right. And the goal of the World Health Organization has been to ensure that everyone, irrespective of your status, you have the highest right to health care. So that was what I saw in my work, and I was able to put these together and submitted what I have now. So thank you, Maria. That's what I can say.
Thank you so much, Florine. Thank you for sharing your experience. It was incredibly interesting. We're gonna keep on going, and then we can go back to more questions or to final final remarks. So, Dr. Sambo, please go ahead.
Okay. So, good evening. I'm Dr. Sambo from Nigeria. My story was on inequity in health workforce deployment in the local government area. Now, I went back to 2021 when during immunization outreach. I arrived at the village and saw it locked, and the only nurse there happened to be transferred with no replacement. And there beside sat a mother who had walked some kilometers with her baby for vaccines. And she asked the question, why are there no health workers, whereas in the nearby town, some 15 kilometers away, there are several nurses. That was the moment that hit me hard. It was an unfair thing to me. Now I realized that urban families were receiving timely care, but rural families were being denied simply because no one was assigned to serve them. But sadly, this was not an isolated incident because I also had stories of, especially a pregnant woman that died. She went into labor, but there was no midwife nearby. And this really mattered because they aren't isolated cases. They are part of a bigger problem. In Kaurua, in many rural areas, women and children face higher risks, not because clinics don't exist or because people don't care, but because of where they live. In Kauru, health workers are clustered in towns, leaving rural families behind. This is actually unjust. It shows how geography and unfair deployment can decide who lives and then who dies. Now, looking at the context in Kauru, is a very, one of the most remote local government area of Kaduna State in Nigeria with an agrarian economy and scattered villages. Now, the government has built many PHCs, even in remote wards, but they are underutilized because of lack of human resources. And there was an assessment in 2019 that found out that 75% of the facility in the local government are underutilized simply because there were not enough medical personnel in the healthcare facilities. In some communities, you have one essential health worker that is expected to manage an entire facility. And looking at the local government area, the health workforce, we try to compare it with what's happening in the country, is below the Nigeria, health workforce density is below that of Nigeria. That of Nigeria 1.95, which is even below the WHO standard of 4.45 per 1,000 population. The immunization coverage is also below the states and the national average. So we try to analyze the root by asking the 5 whys, and after asking repeatedly, we understood that the underlying root cause appears to be a systemic neglect of rural community needs in health workforce planning, driven by a lack of incentive structure and weak advocacies. Now, I also look at my role. I had earlier served for about 19 years with the World Health Organization as an immunization officer. It is a professional role that granted me certain advantages and power. For instance, I have access to data, immunization data, and other health data. I can easily call meetings with local health officials, and I can say I'm relatively well connected in the health sector, having spent such a large amount of time. And I felt I recognize I can actually use this positional power that I have to amplify the community's concern. I also recognize that I may hold some institutional power and knowledge, but the fact is the community members possess the lived experience and moral authority more than me. So my plan must shift towards the community, meaning that community should co-drive the solutions, and I will only act as a facilitator, a supporter, rather than someone that is going to impose an external agenda. And also my role in summary will be to bridge gaps. I should be able to connect data and policy with the realities on ground so that I can empower them rather than single-handedly try to fix the problem. In my action plan, I had a goal to achieve more equitable health workforce deployment in Kauru, especially within 1 year. And my plans will involve engaging stakeholders as partners in trying to solve the problem. So we identify some stakeholders like local government, health departmental leadership, traditional institutions, health workers, union, women group, community-based organization, community members, chief officer, and local political leaders. And we have some action points that we will carry in the plan, and they include baseline assessment initially and stakeholder alignment and community dialogue forum, root cause analysis workshop and solution design. We have to hold that again. Advocacy to policymakers, implementation of local incentives, and then capacity building, community mobilization. We also have midterm review and course correction and try to secure sustainable policy changes and then evaluation. Now, in our work plan, we also added a logic framework that tries to marry the output and outcome and then the impact together so that we can see what the impact is at the end of the day over a period of 24 to 36 months. Now, we have some health equity principles that we embedded in the project, like community empowerment, intersectionality, social determinants, and then proportional universalism, accountabilities, and sustainability. Now,
Sorry, Dr. Sambo, to interrupt, but we need to round up so we can give opportunity to everybody else. But you're great, thanks.
So we identify, rounding up now, we identify some limitations and challenges like funding gaps, resistance, security concern, policies making, and then we also identify some resources we may need, like technical support, data, finances, and some policy support and alignment. And lastly, we were able to link our project to the SDG goal 3 and 10. So that is all for over. Thank you very much.
Thank you so much, Dr. Sambo, for sharing. We're going to continue, so everybody has a chance to let us know and to let us know how it went, right? So you can guide yourselves for some of the questions on the screen. But the main thing is in 4 to 5 minutes, let us know what was your project like and how did you analyze it. So Chinyelu, please go ahead.
Okay, good evening all. My name is Chinyelu Ekunife from Nigeria. Actually, I'm a lecturer in the university. And my project line was on the influence of lecturers on the mental health of female postgraduate students here. The key word here is female postgraduate students. And I am the associate provost of the postgraduate college. So oftentimes, most postgraduate female students come to me to report. Some of them will even withdraw from school. And I notice that there is something disturbing them, some from their family. Then the root cause, I traced it that most lecturers always disturb them, especially when they don't attend lectures. And one of the women I interviewed said that she lost her husband. And as a result, she was not able to meet up. But when she now came to submit her assignment, the lecturer refused. And thereby adding to the mental health of the student, negative mental health, and the student had to withdraw. Then I took it upon myself to see how I can remedy that. So I now traced the root cause. I traced it down and noticed that it was not just from the school, but we have to look at it from this angle, that the community I work with is now the university and among the postgraduate students. But when I traced it down to gender discrimination, because the woman was absent. Apart from the fact that she was absent, I realized that it was the role they play in their various homes that made it impossible for her to start attending lectures. And the men see it that because she lost her husband, or because she must give birth, or because she must carry out some activities in the house, she mustn't attend lectures every time. So the root cause was gender discrimination. But because is from outside the house, but they carried it into the school. And the lecturers also added to the problem. So I felt I should solve the problem within the school system first. So lighten their problem and then probably reduce their mental, whatever that is disturbing them. So my action plan was to organize workshops for the students and then for the lecturers. I even also included the postgraduate students into the committee. Then, because most of these students may not be able to attend, I had to work on the lecture. And because I'm the postgraduate associate provost, I had to speak with the provost for us to start organizing the workshop. And that is where my role comes in. Then in my action plan, I had about 5 items. The item 1, the audience, the time for the or period of this workshop, duration, the organizers and those that the first person that will partake in the workshop. So out of the 3 items that I have, the students, the female postgraduate students must be trained. Then the teachers must be trained too, for them to know how to handle the female students and then to not add to their problems. And lastly, a committee must be set up. Among this committee, students, postgraduate students must be part of the committee. So I itemized the action plan, those that will organize it, the duration and so on. But I stopped there. The reviewer of my project added 2 very important things, which are also added when I reviewed my project. Number 1 is that I should expand my project to a broader context, bringing in cultural expectations placed on the widows, which happens in the community, but they'll bring it into the university. Then also how the university regulations may also unintentionally discriminate, so that we know how to handle that. Then the reviewer also said I should strengthen the action plan by adding clear success criteria or expected outcome. That I added. So that addition will also bring out the outcome and will make it easier for me to measure progress. Thank you very much.
Thank you very much. We're going to move to Dr. Elizabeth Ojuwole, and afterwards, I'm going to suggest that we look into a different approach, and I'm going to show you a couple of other questions that we want to hear from you on how it went with the project.
And Maria, I just wanted to suggest that we respect our rules of equity. We have listened to 2 people from Nigeria, 1 from Cameroon. So my suggestion would be maybe we go to another continent or another country that's outside Nigeria and Cameroon. And so far, I like the fact that there's been equity in gender, but I think we have to look at geographical equity as well. And sorry, Dr. Oduwole.
You're completely right, Charlotte. So from you who have raised your hand, we can follow Charlotte's suggestion. So anybody that is not from Nigeria or Cameroon.
I think we have Chris, we have Francesco, Chris.
Chris, there we go. Chris, are you able to speak?
Are you speaking with me?
Okay, Francesco can go ahead.
Yes, I don't know how to upload my presentation PowerPoint. Is possible? Where is the?
I can let you share your screen. We just have to keep in mind that we are on a time limit, so you should be able to share it now. So you only get 4 minutes, and the last one to round up.
What is possible?
At the bottom, it should say a green button that says share with a green arrow. That's how you're able to share.
Okay, green arrow. Yeah.
Yes, and that's where you share your screen.
Okay, yes, now.
We're not seeing it yet. but it should.
This is condivision. No, it's not working on share screen. And where is share screen?
You
No.
have a green,
No, I have no green. I have no green arrow.
no, it's a green box with a black arrow inside. It says share.
Yes,
Okay.
it's a share. I saw share screen, but it's not unlighted. It's dark.
Oh, I'm sorry. It should let you share instead of giving you, right? Do you want to start talking in the meantime? And I'm gonna look.
Yes, of course. Hold on. My project is about the application principles of human factor. Okay, I worked in aviation, and we use very much this method to avoid failures and deaths and the accident. And now, all over the world, they are using this method to avoid that's also in health service. This is a project because it is a way of rethinking big team working to take care of mistakes, to manage the management of mistakes of people. So my idea is to make specific training. This is possible to make it also online. After there is, it will be a period of monitoring of activities. After that, we make some meetings and briefings to speak about what are the problems, why if it's possible, or what we can do better. That's usually this is a low budget project. We can use it all over the world, everywhere. There is a team working for health service. You can use this. It is a different way to work, to manage mistakes, to encourage people for a better communication and better team working. That's I think it's absolutely equal. I think if I am on disposal because to share my experience with everybody wants to apply this method. That's all. That's all my idea. I'm sorry I made a little PowerPoint to show them. I cannot upload this.
No problem, Francesco. Thank you so much for sharing. Let me move forward. So for those of you who still have your hand raised and want to share with us, and remember what Charlotte had just brought up about our rules of who can or who would we like to hear from next. I wanted to ask you about specifically about what was the most significant improvement that you have made. Okay, what's the change that you have done to your initial course draft, and if it was based on peer feedback, and to let us know how does this improvement enhance your action plan. So for those of you who have still your hands raised, and maybe somebody who is not from Nigeria or Cameroon or Italy, Chris, are you able to speak?
Can I
Well,
speak, please? Hello?
Yes.
Hello, Maria.
Yes,
can speak.
hello.
I'm sorry, I'm Tamrat. Could I possibly share, please?
Yes, are you going to share your, do you want to answer this question about the improvement?
Yes.
Yes, go
Thank you
ahead.
Thank you very much for the opportunity. I am Tamrat. I'm working for the Ethiopian Red Cross Society. My topic is exploring inequality in flood disaster. At the very beginning, before my reviewers checked it, my topic was not like this. I edited and changed it like this because the first one did not include inequality. The other thing, my reviewers reviewed and they really advised me to make it the content is clear, the background as well. Actually, at the very beginning, I didn't add the culture of the people and so on. Therefore, I added the culture of the people where the disaster happened, and again the root cause self-reflection as well did not flow sequentially. After my reviewers gave me the advice, I made it clear following the sequences. The other thing, I didn't clearly put the planning. My planning was not clearly put. After my reviewers added their comments, I put the important point is the time frame, whom I should include, and also the goals has been included after I have reviewed my reviewers comments. The other thing, in the very near future, what am I gonna do? One, planning before the disasters happens. Making preparedness is very important. In the very future, I have to plan before the disaster happens, making preparedness. The other thing is sticking to Red Cross principles, such as humanity, impartiality, independence, unity, universality, neutrality, and voluntary service. It has to be stick to this one, which includes as humanitarian. The other thing I would add in the near future is that identifying the vulnerable groups, such as the pregnant women, children, elders, and the disabled, should be identified before the disaster happen. The inequality in health inequality is that even though this flood usually appears every year, there is negligence from the institute that has to follow this preparedness. Therefore, there is inequality in following this disaster happening. It is more than emergency because it happens in great mass. The other thing is collaborating with stakeholders like the government in the near future. The stakeholders, also there are Red Cross partners who are working with the Red Cross. I would include, I will initiate them to work collaboratively with us. In addition to this one, working with the university scholars so that they can get engaged in research making. Thank you for listening. That's all I have for the moment.
Thank you, Tamarat. Let's hear Elizabeth Esteora. Can you share about on your project, what was the most significant improvement? Are you able to unmute?
Okay, good afternoon, Maria, and everyone on call. Happy to be here again, once again. Okay, in my own projects, not my own is like it looks different from others. Because in other inequity, we are looking at only the side of health workers not meeting up what they should do to people. Maybe because they are neglected. But this my own. It's like the health workers, we are ready to work, but the people are not ready to accept the health services rendered to them. Like parents rejecting, denying their children immunization, vaccine. So in my project, the change I made is about, in the first instance, I just mentioned the family. But after the review corrected, I put other variables like religious, misconception, misinformations, and even poverty that may be part of the cause of the root cause. Then for my action plan, I also put more insight into edutainment, even involving having a stakeholder meeting with the religious and religious body and the education people, because the community, all those people are part of all those people we are part of the community. The religious are within the community, other groups are within the community. I also added flag offs because in a flag off, opportunity would be there for even the rich men, the poor men, to see other people, to see the children of even the religious being vaccinated. So those other women will see them, and from there get involved in having their own children vaccinated. Because I tell somebody not to do this, and they see me doing it, they will say maybe I'm misleading them, or they have changed their mind to do what we are doing. This project is a very big lesson to me, because in a place like this, I mentioned only one, but I've met other areas, but I didn't mention them in my first write-up. But I mentioned other places that I saw. All these are the challenges, are these that input that my reviewers helped me to put up after the revision. I don't know whether I'm answering your question.
That is great, Elizabeth. Yes, thank you so much for sharing. I'm gonna, in interest of time, I want to hear about the peer learning experience. So, our next speaker, I want to know what was the most valuable aspect of the peer review process for you as a reviewer and as someone that has received feedback. I saw that someone in the chat had brought it up before I even put this, that was the best part of the course. Timothy was saying that reading reviews was what he had enjoyed the most. So maybe Chris, that I see your hand is up and your mic is unmuted. Let me know, what was it for you to the peer learning experience? Let us know.
The peer learning session also help a lot, because everyone's question help us realize our own improvement. First of all, for the feedback, I used initially a wrong format. I don't want to do it, but I do it, which made it difficult for those who gave me time to evaluate my project draft. And with this occasion, I want to thank them for succeeding and for sending me very good ideas. Later, I was attentive to all the proposal, and I noticed that I didn't make a story. It was just like a list of ideas, which did not make sense for those who saw the story for the first time. And so I took the format and developed a story on each stage so that it made sense for everyone and anyone who wants to know more about my project. And also thank you for letting me be present in this course, because I learned very much from all of you.
Thank you so much, Chris. Thank you. Okay, I want to hear one more. If Alfred, we can go to you on how was it for you, the peer learning? Go ahead.
Okay, thank you. Thank you for giving me this chance to also share my experience as a reviewer and as also a person who received feedback. So as a reviewer, I can say the most valuable aspect that of the peer review process was that and it really sharpened my critical thinking and analytical skills. And by assessing someone's else work, it also gave me a chance to reflect on the standards of quality, the organization and clarity of the project, and also it allowed me to see different aspects or perspectives of how people are also doing their projects. And then the person is receiving feedback, and the feedback really highlighted the blind spots or the gaps that were there in my project. And also it gave me a clear sense of how my writing or address is understood by others. And also it provided me with practical suggestions of how I can improve my project. So it really assisted me both as a reviewer and also as a person who was receiving feedback. Thank you.
Thank you so much, Alfred. And let me move forward to our real world application. So the next question, or the next participant, I want to know, how do you anticipate applying everything that we have learned in the past few days with this peer learning process in your everyday work? Dr. Subhajit, I see you have your hand raised. Are you able to speak?
Yeah, thank you. This is a really an interesting the whole course and the whole project. And my project was the story was gender inequity in the immunization zero dose implementation plan. I am from India and I have compared two different geographies. One is the northeastern part of India where there is a predominantly matrilineal society, and another part was in the West Bengal slums. So those areas having a different, that is a patriarchal society. So so whenever I have done this project, and initially as I am with WHO and I look after the immunization program of our 200 million population. So I learned a lot during this process because some critical elements which I missed in my initial thought process. Uh, Basically, as a public health professional, I was mainly focusing on the health aspect of the program and the structured aspects. But from the peer reviewer, what I came to know about various community engagements, because community engagements are normally written in the guidelines and the processes, but they are formally not very much included in the operational interventions in the operational review processes, and with that I have observed during my course in the field. So here what I have learned significantly that in this whole process, in this whole action plan, like I mentioned that community-led demand generation, but I have not included that because there is a belief system. So how you will navigate with the community in tandem so that you can change and modify the belief system in the community. So that is what I have learned from my peer reviewer. And also I have learned that how for every decision you have to ensure that community is also a significant part of the decision-making process. So if these two are very critical factors which I have learned, and definitely I will be implementing those interesting suggestions and advice from my colleagues, which they have given. And also during the review of my fellow colleagues' paper, what I understood that outside the public health, the dedicated public health interventions, there are also various kind of thoughts of various stories and various thoughts where uh, human rights and other inequity issues are also important or critical when we are considering any operational intervention involving the overall population or the community at large so that we can solve the critical problems. So these are the few things which I have learned, and definitely I will be utilizing them in my daily action and process as I continuously navigate with the administration, with the community, with my soft power, and with my situation. So definitely I will be utilizing that, and I will try to include these equity principles in practical field operations. Thank you.
Thank you so
Thank
much.
you.
Thank you, Dr. Subhajit. Deborah, I see your hands up. Would you like to answer this? What would be for you your real world application? Are you able to unmute? There you go.
Yes, please. So I've been in this program and also participating in this activity. I have learned a lot, and also it has helped me to appreciate the impact of the people that I'm with in the team. So looking at the different submissions that I got from my fellow peers, they broadened my aspects um, of the project that I was looking at how we can improve vaccine delivery to the underprivileged, especially the hard to reach populations. So with the feedback, I hear in everything, I also need to bring in the aspects of gender, which was brought in by one of the reviewers, and also bring in the aspect of culture, how the parents feel about the immunization, who is reading the homes, and also if there is that openness that without a biases, where somebody can be able to bring out how they look at the program, and also getting different views from the different peers that are in the group. And also, I was able to appreciate what is happening in real world in other parts of the continent. Also, I think I may have a buy-in those and be able to look at how I can also analyze the same aspect, like the issue with Kenya and that Mali that I was reviewing with regard to GBV and also other aspects of intimidation with regards to access to healthcare services. So I think it has been a good experience, and I've really learned a lot. Thank you.
Thank you so much, Deborah. And let me move forward. So last question that I would love to know from those of you who are still in line for sharing is, what is the most challenging aspect of the peer review or of revising your course project, and how did you overcome it? Maybe we can go with Ahmad Muhammad, so we can. Are you able to speak, Ahmad?
Hello, are
There you
you
go.
speaking to me?
We can hear you loud and clear.
Okay. So the most challenging aspect I have gone through my revising my peer group is that most of the reviewers are not reviewing it using in-depth analysis, and most of the one of the project I supervise is not within the scope of what we are doing, because it clearly does not follow all the guidance of writing the project. So I think that one gives me a headache, but I have been able to guide the person through how to write the project, let him go through Rubik and so on. So personally, for me, I don't think I have any challenge regarding my project, because all the ones that within my project, they have given me a better input on how to implement my project and so on.
Thank you so much. Thank you, Ahmad, for sharing
Okay.
that.
Thank
Aondonda,
you.
are you able to speak? Do you want to share with us what was the most challenging to revise from your side? Are you able to unmute? Okay. Oyelaja, please go ahead if you're able to unmute and share with us what was the most challenging on your side. Aondonda, I see your mic is unmuted. Okay. Maybe we are having some connectivity issues, no problem. How about you, Talatu Buba? Are you able to unmute?
Yes, Maria.
Yes, we
Can you
hear
confirm
you.
you are hearing me? Okay, thank you.
We can. Go ahead.
Yeah, so good evening, everybody from Nigeria, depending on where you are joining. So thank you for the opportunity first to join this important conversation. And all I have to say to the organizers of this program, fellowship, is thank you, a big thank you to you. So talking about the most challenging part of the review, or the task of reviewing 3 projects given to me, is basically, I want to say that it is some of these writers or some of these fellows actually took their time to come up with a story, and then they tried their best to follow the rubric guideline, or the guideline in the rubric, and then while some of them did not. Okay, so some of them were just able to just write a statement, and they keep copying and pasting the statement. So when you come review, you find it difficult to, okay, so where am I going to start reviewing? What is this person trying to say? But I want to say that not all, at least I had like 1 or 2 people that actually took their time to do so. And I took my time to to actually review their work and identify some critical issues, and then pathways in which it can help them to come up with a better work. Yes, so that was just the problem I had with some of the work I've actually reviewed. So again, I would like to take this opportunity, even though we've long gone past this process of what we learn and then how we're going to apply it in our real world, real life. So I would like to say that first, the organizers of this important event actually tried very well, and came up with a guideline. That rubric is very, very important. It's a kind of streamline and bring our thoughts together to actually around the issues of equity, right? So what actually made me to join this fellowship is because it's about issues of equity in health. So my joining this fellowship, actually, it has exposed me to understand different dimensions of equity or inequity in terms of issues of health. So I'm a Nigerian and I work within the immunization space. And basically the kind of work I do is about evidence generation. So we all about what we do is to generate evidence in terms of what are those things that actually make people or make women or caregivers to vaccinate their children or not. I'm within the immunization space, and it's about evidence generation. So my joining this fellowship actually has opened my eyes to understand beyond just gender issues, what are those equity-related issues that actually impede against access or optimal uptake of routine immunization. So for me, it is a yeah, and I'm very happy to be here, and I'm learning. I have learned, and I'm still learning from colleagues. Thank you very much, and over to you.
Thank you so much, Salatus. Thank you so much. Okay, in interest of time, let's start rounding up. And I just wanted to share with you once again the link in the chat for the community. If some of you are still facing any challenges and need to reach out, you can use that so we can look into how to help you out. Just a reminder for some of those who have joined late that the deadline for you submitting your final and improved case has been course project, has been moved to the 26th of September. So please take this into account and make the most of the next few days so you are able to submit. So I do want to go to our last slide about what happens for everyone. Okay, just a quick reminder that the TGLF team will review your final projects, and that is how we can actually certify that you have improved them. Okay, there are going to be certification updates on the Go platform, but I will still say something now, and just another reminder that we will check with you about what you have learned and how everything is going after 3 months and after 6 months. About certification, and I want to just go through this quickly, and it will still be in the Go platform. Everyone will receive an official letter from the Geneva Learning Foundation, and this letter confirms that you have completed your activities, okay? This letter does not evaluate competencies, okay? Completers may opt, if you want, for an optional paid certification, okay? The full price of the certification is 990 Swiss francs. This is an official certificate signed by the Geneva Learning Foundation with the official logo. And here the competencies are validated after review of your course project. Okay, because you're the inaugural cohort, we want to thank you and thank the community, because without you, we would not have built this program. We will offer scholarships for certifications to contributors who share their experiences for the special event, and for those contributors who responded to the program consultation, okay? And these of you will have a certification to a reduced rate of 295 Swiss francs. So all of these will be, and all of this that I have just read to you will be part of the Go platform. So you are able to see and to see what's the best way for you. But just remember, on all the activities that you have to have completed to be able to go to aspire to certification. So that is it from my side. Charlotte, anything that you want to do, any final remarks?
Thanks a lot, Maria. I really wanted to first of all thank you for being there, for facilitating all of these sessions, and for guiding our colleagues throughout the whole process. And I really want to congratulate this cohort for the hard work, for the engagement, for the richness in the quality of the contributions. Listening today to what you have learned, how you were able to assess the work done by colleagues, and so many comments, compelling comments here in the chat. I just want to say thank you so much for participating and trusting the process, because that was the most valuable part, being able to trust the process and having that confidence that at the end of it, you'll be able to learn. Also, on behalf of the Geneva Learning Foundation, our entire team, REDA, we really just want to say thank you, and stay tuned in your inboxes and also on the Go platform for whatever updates we may have with regards to future opportunities. And just know that we have many other courses that will be coming your way, and some that are currently on our platform. We have the climate and health course that is being relaunched. It's a self-guided course. We have the equity 2 course that is starting, that is gender in immunity in emergency, sorry, that is also coming up. We have other self-guided courses on measles, and on the Women Empowering Women initiative. So maybe what I'll try to do is to put up as many of the links to those courses here in the chat as I can, so that you can enroll and participate in them. So thank you so much. And please do follow us on our social media. It's the Geneva Learning Foundation. We are on Twitter, X, on LinkedIn, on Facebook, on TikTok as well. So please, on YouTube, most especially, where you can see recordings of almost all of our sessions. So please do follow us on social media, and do well to comment, to like, to share. Thank you so much, Maria. Over.
Thank you so much, Charlotte. And I want to thank you all for participating. It was a real pleasure sharing with you these past couple of weeks. And I really look forward to continue reviewing your great projects. It was an amazing experience, and it's not over. So those of you who are almost finishing, please remember that we have the extension. So you still have a couple of more days to present your final project. Don't forget about that feedback that we're asking. That is also due at the end of the week. And I'm looking forward to seeing all of you in our next courses. Thank you so much. That was it for now. We're signing off. Thank you all.
Can I ask you one quick question, Maria? Do we still have one more webinar?
You still have one more what, Irene? Sorry?
Do we still have one Zoom meetings, or is this the last one?
No, this is the last one. You just have to present the feedback, and if you haven't submitted your final course project, then you still have time until the 26th.
I did it last night. So.
Okay.
Perfect. Okay.
Yeah.
Happy to hear that.
Can we take a group photo if you are able to turn on your webcam, even if you can't turn on your webcam, but if you're able to, we really like to take maybe take a souvenir picture of today's session. Okay, so
for webcam.
Yeah, so if you can turn on your webcam, that would really be great.
Oh, how do we turn it?
Good afternoon.
There we go.
Charlotte.
Just big smiles. That's all we need.
Maria, how are you?
Oh, good. Thanks.
So please just allow me to check. We have a number of screens.
Hello. Why is it that? Good afternoon, all. Happy to hear from you, madam.
How are you?
Good afternoon. How are you?
Good afternoon. Good evening.
How are you? Good evening, all.
Good evening.
This is a very educative
So nice to see you all.
We appreciate We appreciate you, Mariam.
so much.
I wish
Thank
we
you
had,
so
we
much.
had the
Thank you so
applause,
much.
but I think you deserve applause. So
Thank
you can, even if you're alone in front of your screen, you can clap for yourself because you have done a great job.
That's
Thank
it.
you.
Thank you all.
Thank you. Bye.
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 Thank you.
Charlotte and Maria.
Bye bye.
Bye, Maria.
Thank
Thank you so much.
Bye bye.
Everyone.